Hello, friends, and welcome to Weekly Witness, Texas Impact's weekly podcast designed to help mainstream Texans of faith understand the legislative process and help you engage with public policy in the great state of Texas. My name is Scott Atnip, your host and Texas Impact's Director of Public Witness, and this episode is part of our legislative wrap-up series, and we are excited to welcome Diana Forrester, Director of Health Policy with Texans Care for Children, to talk about where the Texas Legislature landed on all things health. And we recorded this in mid-June, and so we touched briefly on actions at the federal level and how it would impact Texas, but trust that we will have other podcasts that will get into more detail on that. The goal of this series is to be a resource for Texans of faith to understand what happened in the legislative session and hopefully be a tool that folks can look back on as we move into election season next year. So we hope that you'll share this resource with your friends who might be interested. As always, if you're interested in working on these issues, Texas Impact has tools and a team for you. Check out the Action Center at texasimpact.org for ways that you can get involved. And I will say that our issue champion teams did incredible work throughout the legislative session, so I hope you'll consider joining one of those communities to connect with like-minded Texans of faith. And with that, I hope you enjoyed this week's conversation with Diana Forrester. Joining us for the program this week is friend of the program, Diana Forrester, Director of Health Policy with Texans Care for Children. Diana, how you feeling today?
Well, I think I've almost recovered from session just in time for them to announce the specials.
Yeah, we are recording in mid-June, so my hope is that all of our guests have had a chance to take a nap. But apparently we're going to be doing this again in July, so yay fun. Yeah. We should have told the governor, we shouldn't be having special sessions until we finish our legislative wrap-up series. We're still doing this. But again, glad to have you with us so we can talk about what happened during the regular session of the Texas Legislature. Let's start out with just kind of general impressions. Was it a good session or a bad session for Texas kids and families?
It was a tough session overall. I would say overall issues, also for families and kids too. It was just a lot of unknowns. Coming into the session, we had almost 30 new members in the House. They elected a new speaker. He fired all of the staff and took a while to rehire his staff. He created this new system with subcommittees. There was so much this system that was new, and so many new people also in those positions. So it was really tough for everyone involved, I think.
It was tough. And as we go through this legislative session, in some of our issue areas, it's almost all bad news. But I like to start with the good anyway. And you actually do have some good news in your issue space. So let's talk about the good bills that passed. What happened good? Bring us some joy. Bring us some hope, Diana.
Yeah. So we work on maternal health and children's health issues. I would say some of the biggest wins this session would be, SB 31, which really clarified that medical emergency exception to the Texas abortion ban. I mean, this is huge. I'm still really surprised that it passed, and it's going to save a lot of women's lives. So that was great. There was also this other bill, HB 18 by Rep. Van Dever, that created this rural hospital grant program, and is really focused on putting money to recruit and retain OBGYNs, emergency physicians, and nurses in those rural areas. So I think that was a huge win too. It was also linked to $200 million in the budget. So, they gave direction to the agency to do something and they funded it. That's a double win.
Love that. Talk about, you did mention the budget, and a lot of what we focus on are bills that pass and fail, and that's kind of easier to track. But for a lot of us, myself included, I'll put myself in the category, harder to keep track of what's happening in the budget as it moves through the process. So talk to us about the budget wins this session.
Okay, so the budget actually had a lot of great stuff in it this session. We had, as far as women's health or maternal health funding goes, they included $20 million for these mobile health units. These are your big, hospital on wheels, kind of the big buses that you see. They started this pilot program last session with $10 million. It's been so wildly successful. They put another $10 million into it for the next biennium. So apparently HHSC got so many applications to the proposal they put out for that. that, they couldn't fund all of them. So that's exciting. I mean, I've had several conversations with the, healthcare workers working on those buses, and just they're seeing people that haven't had access to healthcare in decades sometimes. And it's huge. Like, there was one lady that had had a IUD for 12 years and she just needed it removed, but she didn't have health insurance and that cost money. And so they were able to help her with that. I was actually talking to one of them last week, and they were talking about they were in this one rural area, and this woman brought in her mom because she had a lump that she'd had for a while. And she said, "Can you guys look at this?" And they were like, "Yes, we can absolutely screen." And they're like, "Hey, while you're here, why don't you just come in and get screened too? Like, we can do both of you." They both ended up having breast cancer. And they were able to get them hooked up to Medicaid for breast and cervical cancer. But the daughter was just like, "Oh my gosh, thank you for suggesting it. I never would have thought to screen myself right now." And so I would have been so focused on her, and like, it's great that we can do this together and we have each other. So that program is really, impacting people in those rural underserved areas. Additional funding ones would be Texas AIM. This is our program that DSHS runs. They have all the hospitals come to Austin like one weekend a year, and they basically teach them how to do a certain bundle. So like, for example, a hemorrhage bundle. Like, here's how you treat hemorrhage. Here's how you the policies you should have in place. Here's all the equipment that you need. Here's how to do the drills on this and how to train your staff, and then they can go back to the rural hospitals and implement these things. It's one of our most successful programs. It is making a huge difference at our maternal mortalities. That got an additional $3.5 million in funding. We also got some syphilis funding, $9 million for that. We have like a 400% increase in infants being born with syphilis. And it just hasn't been around a long time. So a lot of doctors don't even know how to treat it or what to look for. And so this is really going to help with educating and getting the word out there on how to treat this stuff. There's a family medicine OB program that got $5 million. In our rural areas, often the physicians out there are like family medicine practice, right? They treat everything. And so they don't have specific training in obstetrics. And a lot of them have asked for that, but it takes money. And so this 5 million is going to allow them to get kind of more specific obstetrics training so that they can feel confident delivering babies in those rural areas or knowing when to refer them somewhere else. And then the maternal mortality review system got an additional 5.6 million in funding. It's not really like a sexy policy win, but it will help with the review of those death files because it's a technology infrastructure investment kind of thing, so that the committee can review those death files and make recommendations in a more timely manner. So hopefully we can respond better as a state. A couple more. Okay.
I keep rolling. We love good news.
Yeah.
We'll give you as much time as you want to talk about
Okay.
good things that happen in the legislature.
Yeah, one of the things going into this session that we were really pushing was HHSC was asking for like this $300 million ask to kind of revitalize the TIERS program, which is the eligibility technology infrastructure. And the legislature fully funded it. I mean, they got over $300 million to kind of upgrade that system, which is huge. We haven't upgraded this technology in several decades. Just to give you an idea of what this looks like, the Medicaid application is about 40 pages long. And so if you're an eligibility worker, somebody submits an application, you then have to go in and manually enter every one of those pages into the electronic system. And this is like old technology. And so it has like a date field, like the date you're doing it, but it's in a different place on each page, each of the 40 pages of the application. It's one of the most common errors is when the worker gets to the end of processing this application, they hit submit and it'll say, "You missed a date field," but it won't tell you what page it's on. So you have to go back through the 40 pages
Oh
looking
my.
for this random date field to fill in. Like stuff like that would be common sense if we were implementing it today, right? Like pre-populating a date. So it really needs to be updated. And I'm really excited that it got the funding to do that. I think this will make a huge difference for the agency, for the eligibility staff, but I also think it's going to help families a lot too, because they're going to be able to get better information in a more timely manner about their applications. Another program we work on is early childhood intervention. This is for our little babies from 0 to 3. It's like occupational therapy, speech therapy. We have about 40 programs around the state doing this. And essentially, they included an exceptional item for $18 million. And this it's kind of like base level funding. So when HHSC requests for funding, they cannot include projected population increases for that funding. And so this exceptional item basically just says, hey, we have good reason to believe there's going to be this extra number of kids in the next 2 years that we're going to need an additional 18 million. And the legislature funded that. This is huge because it's a really small program and often does not get funded. And so this is really keeping it from getting a cut this next biennium, which I think is crucial, especially with all of the Medicaid stuff happening. So we were really excited to see that. Additionally, at the start of this session in the base budget, they had cut the women's health program funding by like $100 million. It was a significant cut. And so the Women's Health Coalition and other groups worked really hard throughout session to make sure that that got fully funded by the end. They did fully fund it, which is amazing and really needed. And then this one's kind of nuanced, but for our Healthy Texas Women program, which if you're not eligible for Medicaid, you can probably qualify for HTW. And it's really just basic contraceptive and screening services around the state. And it used to have a 2-page application because it was just for contraception and screening. But a few years ago, in all their wisdom, the legislature moved this program into the Medicaid department, which meant if you were trying to apply for HTW, you had to go through the 40-page application to prove that you were not eligible for Medicaid to then get to the HTW program. And we've seen a significant increase in the number of people getting denied because of this. It's just a really laborious application. And if you're just trying to get birth control or like a basic pap smear, like people don't want to fill out a 40-page application that includes tax status information. So there was a rider that made it in there that just basically says, hey, HHSC, please go back to the 2-page application for this program. This is a huge win. It's going to make a huge impact for our women's health providers around the state. And it's going to mean more women can get access to those crucial services.
Love it. Love it. Love that list and some really great items that went through the budget process. I know this might not be in your portfolio at Texans Care, but I know there was also a lot of excitement about daycare.
It was. Yeah, my coworker David got $100 million in the budget, or in one of the budget bills to increase so currently Texas has a program where you can apply for subsidies basically for these daycare programs. And we have an insane backlog. There's like 900 people on the list or something crazy like that. And you can wait anywhere from 6 months to 2 years to get a slot. And so this is for low-income families that need access to daycare so that they can go to work. And if you are a parent, 2 years is a long time to wait to get a placement. So yes, this $100 million will really help create a lot more opportunities for families kind of at that poverty line.
I love all of the positive work and really applaud y'all for y'all's work in that budget process. So a lot of things we've talked about will save lives and will make lives better for Texas families. That said, I don't want to paint an overly optimistic picture of what happened during the Texas legislative session. Talk to us about some missed opportunities.
Yeah, there's always some missed opportunities. I think in the world of maternal health, the two things that I'm most disappointed about would be HB 220, which was really just directing hospitals to offer Plan B to people that were raped that come in for a rape assessment. And we got so close on this one. We got it through the House. We got it to the Senate. We had a hearing on a Sunday in the Senate on the last week of session. All they had to do was vote it out. But Right to Life got an amendment on it that really made it meaningless. So we stopped working that bill at the end there. So I was really sad about that one. And then just the doula issue in general, we've seen a ton of national data like really supporting the incorporation of doulas and increasing health outcomes for moms and babies. And we were really hoping to make some movement on this issue in Medicaid this session. I thought we had a really good chance, but it ended up being really hard to get people to move on this particular issue, especially with the looming Medicaid cuts at the federal level. That was a big stickler for a lot of people. So there was one bill, HB 1201, that made it over to the Senate and did get referred to committee, but it didn't get any further than that. So I still think that's a great issue and one that we can work on next session. We did a lot of education this session with a lot of new members and some older members too about what is a doula? Why is this something you need? Some lawmakers thought that people just get sent home with a doula already from the hospital. And I was like, if you want to write that bill, let's do it. But I think we have a good foundation to work on for next session on that issue. There are a couple other ones. HB 321, this is one of our babies from last session. It was expressly an eligibility. It really just allowed HHSC to notify parents that their kids were eligible for Medicaid. So, HHSC runs Medicaid and SNAP. And so we have all of these kids that are on SNAP. And so we know that they're actually eligible for Medicaid because we have all their info for SNAP. There's 100,000 kids on SNAP that are eligible for Medicaid but not enrolled. This bill would have just allowed HHSC to notify the parents and said, hey, did you know your kid qualifies for Medicaid? Are you interested in enrolling? Because one of the biggest things we hear is just that parents don't know what's out there. They don't even know where to start. And it's overwhelming when it comes to health insurance. And so we were hoping that this could really make a difference, but that did not. It really was a no-go this session, unfortunately. And then HB 3917 by Rose. This currently a pediatrician can screen a mom for postpartum depression, but they can only get reimbursed to do it one time, even though the, best practices and ACOG recommendations are, up to 4 times because they see them over that span of, the first few months of the baby's life. And so this bill would just allow them to get reimbursed for postpartum depression screening up to 4 times if they felt like that was necessary for that mom. I thought we had a pretty good chance at this one too, but politics ended up getting in the way of that one. So it had nothing to do with the bill itself, just some personality issues with people. And then there was one more I wanted to highlight is HB 2159 by Rep. Gomez. It would have allowed minor parents to consent for their own healthcare. In Texas, if you're under 18, you cannot consent for your own healthcare. And so this means we have a fair amount of 17-year-olds that are giving birth and they can consent for their baby's open heart surgery, but they cannot consent for their own strep test or IUD. And often in these situations, their parents are not super involved. And so it becomes hard to get them access to healthcare services. This bill would have just allowed these parents, parenting minors, to consent for their own healthcare. We've been working on this issue for a long time. This is the furthest it's ever gotten. Got all the way through the House, all the way to the Senate. We got a hearing in the Senate. It was just an issue with it got to didn't go to a health committee, went to like an insurance committee, and they just didn't understand the issue as well. So, but that was really encouraging that it got as far as it did.
Yeah, so we usually end these episodes by asking people, asking guests what our listeners can do moving forward, and we'll get there as well this time. But in this issue space, there's a real opportunity above and beyond many of our other issue areas because of the sunset process for HHSC coming up this biennium. And we're going to talk a lot more about the sunset process and specifically about what people can do as part of that process as that gears up later during the interim. But while we're thinking about missed opportunities and while we think about what happened during the legislative session, are there areas that you think will have particular nexus with that sunset process that we should be paying attention to right now?
Yeah. So the sunset process, each government agency has to go through the sunset process, and it's every so many years, the legislature reviews essentially their effectiveness, and they basically have to prove why they still need to exist. And so this interim, their sunset committee is going to start going through HHSC, I think it's DSHS, and it's also DFPS and TWC, the Texas Workforce Commission. So this is a ton of our really big agencies that affect families. And I think it's always an opportunity to reevaluate what's working and what's not. Part of this sunset process is they do involve a lot of stakeholder feedback and public comment periods. And so we will really be trying to get people involved that are interested in these issues in submitting public comments and showing up to these meetings and stuff and providing feedback on the programs, what's working and where we can maybe do things better. So I think that is an exciting opportunity. It's also a little overwhelming. to be doing so many agencies at once, but we'll get there. Additionally, I just wanted to talk about like kind of like these three themes that I felt like came out of session this year that were a little bit different. It's like overall, I think for this interim, we're really going to have to focus on defending our safety nets. There's just kind of like this overall trend of moving, you know, taxpayer dollars from things that used to be public goods to privatization, and um it's going to quietly defund our healthcare infrastructure. I mean, these bills at the federal level about Medicaid cuts are significant, and Medicaid is our biggest insurer in the state. It covers half our kids, half of our moms, and so any reductions to it are going to have serious implications for the overall system of how we get healthcare in the state. The other trend I saw was really like, I think we need to look beyond Medicaid as far as a provider for healthcare. I ran into this so many times this session, just this very strongly held belief that the government shouldn't be an insurance provider. That's not the role of the government. They shouldn't be doing that. Which in and of itself is an ideology that, maybe I could get behind if there was a transition plan, but it doesn't seem like there's an alternative that they're offering. It's just like, we got to get out of this. And so for me, I see turning into the interim, it's like, we need to figure out what other options are out there, what is happening at the local level, what kind of, charity clinics exist, and we need to try to fortify those as much as we can before we kind of had this influx of need hitting them. And the third one is really this trend on like health is like a personal responsibility. A lot of the legislation that came out of the Senate specifically that had to do with healthcare for children was really focused on, eliminating dyes from our foods, changing the way the nutrition labels are done, increasing recess time and physical, activity in schools, which are all great. But in my mind, it's like, it's not one or the other. Like yes, we definitely need healthier food. We definitely need more activity, but we also still need to have access to healthcare. Like you can't have a good diet. You can't diet your way out of hemorrhage. Like there are just going to be certain situations where you need that. And so it was shocking to me to kind of see this focus on personal behavior and making healthy choices as the only solution. And I just want to, I feel like we have to kind of get the message out there that like individual responsibility is important for sure, but it can't replace this systemic access to healthcare.
Yeah. Healthy behavior at the expense of healthcare is kind of a crazy argument. So you mentioned Medicaid, and pull the curtain back on what's happening right now. We're recording this in the middle of June, and so I don't want to get too deep in the weeds when we're releasing this several weeks from now. That said, there are certainly efforts in DC to scale back healthcare and put a bigger onus on the state. Anything that we should be watching moving forward that you think will still be relevant in a few weeks?
Yeah, so at the federal level, the big beautiful bills with the Senate right now, and supposedly they're going to get their version back to the House by July 4th. And I think as far as Texans go, we have a shot at being influential when it gets back to the House. We have some leaders in the House that I think we could really pressure to try to vote no on that bill, or at least let them know that there are going to be ramifications if they vote yes for it. And so I think that's going to be really important. I mean, a lot of the provisions in the Senate version right now, and this is all going to change probably, have to do with penalizing states that expanded Medicaid, but there are certain things in there that are going to have an effect for Texas. And one of the big things is like these provider taxes, which is a big way that we fund our healthcare system. And they're getting it looks like they want to do away with kind of that system of funding in general. And so I just don't see a version that comes out that doesn't include something along those lines. So it's kind of like the way we've been thinking about it is like they're kind of like these two scenarios, right? Like one is like death by falling off a cliff. It would happen overnight. That's not the version we have right now. The version we have right now is kind of like the being slowly boiled to death. It's like It's going to take a long time. You might not notice it right away, but it is going to quietly defund our healthcare infrastructure.
All right. So a lot that listeners can be doing over the coming weeks and months. What tops your list? What do you wish people would be doing?
Yeah, I think just making sure that your representatives and your senators know that, cuts to Medicaid is going to have serious implications for our state. It's going to really affect families all across our state. And there's also this element of, they're including SNAP also. And we have millions of kids on SNAP in Texas. And so I just think there's not a version of this bill that doesn't seriously impact families, especially those around the poverty line or below. But additionally, I think it's just going to really hit the middle class hard too, because one of the things they're trying to do is minimize access to the marketplace healthcare insurance. And that's what I have for my family. And I don't know what we're going to do if they get rid of that. So I think, yes, please feel like this is the time to get involved. This is the time to notify your representatives that Medicaid and SNAP cuts are not okay, that we want our tax dollars to pay for this, and we don't want people to be dying because they just don't have insurance or don't have food.
Yeah, so as we go throughout this legislative wrap-up series, one of the things that we're going to be asking people is to have conversations with their state elected representatives as we move kind of into the accountability phase of the biennium and into election season. What do you hope they'll be focusing on as they have those conversations with their state elected officials?
Yeah, I hope they would really focus on the good things that Medicaid does and SNAP does. I mean, I think if you look at history, the whole reason we even have these programs is because, the churches were trying to fill those needs and it was so overwhelming. They couldn't meet the need and people were dying in the streets. That's literally what was happening. And our president was like, this is terrible. We can't be a nation that lets people just die in the streets. And that's where these programs came from. So this whole narrative around the government shouldn't be doing this. It should be churches. It should be local communities. I get it. And as a churchgoer, absolutely, churches can be helping. But I think history has shown us, it's not big enough to support the need. And that's kind of one of the things that I thought made our nation great is that we came together and said, no, it's not okay for people to die of preventable things like hunger and healthcare access. So I would really encourage people to push back on that narrative and just really emphasize how these programs uplift and support our society and the families all over our state.
Yeah, I like that. That history reminder that it was church folk, it was people of faith who helped spearhead a lot of these the same programs that now government is trying to return to local communities and faith-based institutions. And so I do think it's important when we have those conversations in the coming weeks and months that we do put our faith hat on and talk about the important and talk about the positions, the historic positions the community of faith has had towards lifting up the vulnerable and providing food and health system. So I love that. Anything else before we close out today, or any shameless plugs you want to leave us with?
No, I mean, if you want to be more involved in the Medicaid stuff, you could check out our website, txchildren.org. We have updates on there very frequently. But yeah, I think I would just continue to encourage everyone, to have hope is to be brave. And so let's be brave this interim.
To have hope is to be brave. Love that. Diana, thanks for all you do. Thanks for incredible work throughout the legislative session and for spending a few minutes with us today. We'll look forward to talking again soon.
Thanks.
I hope you enjoyed this week's conversation with Diana. Health policy will definitely be an emphasis in the coming years, so I hope this serves as a good starting point for what happened during the regular session. And as always, we appreciate Diana for taking the time to be with us. And as we focus on the session wrap-up, I want to again plug the Texas Impact issue teams. This is going to be an important issue area in the future, so I hope that you'll sign up to get involved. Take a moment to check out the Action Center page at texasimpact.org and consider signing up for one of the teams. If you're already a member, thank you, and I hope you'll encourage your friends to sign up as well, so consider how you can promote these opportunities to get involved. And I want to thank you again for listening to this podcast throughout the session. I look forward to future programming. If you have suggestions or ideas, please share them. My email is scott@texasimpact.org. While you're on the website, I hope you'll take a moment to sign up to be a member of Texas Impact. Your membership supports this podcast and all of the work to engage Texans of faith to advocate for a more just and equitable Texas. So with that, I think it's time we close out this episode. So remember, the world needs Texans of faith active and engaged. So let's get to work.
Weekly Witness is hosted by Scott Atnet, engineered and produced by David Fasalo. Our executive producer is B. Moorhead. The opinions expressed on Weekly Witness are those of Texas Impact and our guests, and do not necessarily reflect the views of our sponsors. Weekly Witness is a product of Texas Impact, people of faith working for justice. Visit us online at texasimpact.org.